As you approach the final weeks of pregnancy, it's normal to feel a mix of excitement and impatience. The anticipation of meeting your baby can be overwhelming, and for many expectant mothers, the desire to jumpstart labor naturally becomes a common thought. While it's crucial to consult with your healthcare provider before trying to induce labor, there are several natural methods that some women swear by. In this guide, we'll explore various foods, activities, and tips that may help encourage labor to start naturally. Keep in mind that these methods are meant to be gentle and supportive, and results can vary from person to person. Understanding natural labor induction. Before diving into the methods, it's important to understand that labor begins when your body and baby are ready. The timing of labor is influenced by a complex interplay of hormonal signals, particularly the increase in oxytocin, the hormone responsible for stimulating contractions. Natural labor induction methods aim to support your body in this process, but they should never be used as a substitute for medical advice or intervention. Foods that may help induce labor. Several foods are believed to have properties that can help nudge your body into labor. While the evidence supporting these foods is largely anecdotal, many women have found them to be helpful. Number 1. Pineapple. Pineapple contains an enzyme called bromelain, which is thought to help soften the cervix and stimulate labor. The key to benefiting from pineapple is to consume fresh pineapple, as the enzyme is destroyed during the canning process. Eating large quantities might be required to see any effect, so enjoy this tropical fruit in moderation as part of a balanced diet. Number 2. Dates. Dates are often recommended to pregnant women in the final weeks of pregnancy. Studies suggest that eating dates may help ripen the cervix and reduce the need for medical induction. A small study found that women who consumed 6 dates per day during the last 4 weeks of pregnancy were more likely to go into labor spontaneously and have a shorter first stage of labor. Number 3. Spicy foods. Spicy foods are a popular choice for those looking to induce labor naturally. The theory is that spicy foods can stimulate the digestive system, which might in turn irritate the uterus and trigger contractions. However, it's important to be cautious with spicy foods, especially if you're prone to heartburn or indigestion, which are common discomforts during pregnancy. Number 4. Red raspberry leaf tea. Red raspberry leaf tea is a herbal remedy that has been used for centuries to tone the uterus and prepare it for labor. While it may not directly induce labor, drinking this tea in the weeks leading up to your due date is believed to strengthen uterine muscles and promote more efficient contractions when labor begins. Number 5. Castor oil. Castor oil is one of the more controversial natural methods for inducing labor. It works as a powerful laxative, and the idea is that stimulating the bowels can also stimulate the uterus. However, castor oil can cause severe diarrhea and dehydration, so it should only be used under the guidance of a healthcare provider. Number 6. Evening primrose oil. Evening primrose oil is often recommended as a natural way to ripen the cervix and prepare the body for labor. It contains prostaglandins, which are hormones that help soften the cervix. This oil can be taken orally or applied directly to the cervix, but again, it's important to consult with your healthcare provider before using it. Tips and activities to encourage labor naturally. In addition to dietary choices, certain activities and tips might help encourage labor to start. These methods focus on promoting relaxation, increasing oxytocin levels, and gently encouraging the baby to move into the optimal position for birth. Number 1. Walking. Walking is one of the simplest and most effective ways to encourage labor. The movement helps the baby descend further into the pelvis, putting gentle pressure on the cervix, which can help it dilate. Walking also promotes the release of oxytocin, which can stimulate contractions. Try to walk daily, especially if you feel early signs of labor starting. Number 2. Nipple stimulation. Nipple stimulation is a natural way to boost oxytocin levels, the hormone responsible for triggering contractions. Gently massaging or rolling your nipples for a few minutes several times a day can help mimic the natural stimulation that occurs during breastfeeding. Some women find this method effective in starting contractions, but it's important to proceed with caution and consult with your healthcare provider. Number 3. Sexual intercourse. Having sex is another natural method believed to help induce labor. Semen contains prostaglandins, which can help soften the cervix, and orgasm can stimulate the uterus to contract. While this method may not be suitable for everyone, it's a pleasant and intimate way to try and encourage labor. Number 4. Acupuncture. Acupuncture, an ancient Chinese practice, involves inserting thin needles into specific points on the body to stimulate energy flow. Some studies suggest that acupuncture may help induce labor by encouraging cervical ripening and stimulating contractions. If you're interested in this method, it's important to seek out a qualified practitioner who is experienced in treating pregnant women. Number 5. Acupressure. Similar to acupuncture, acupressure involves applying pressure to specific points on the body to encourage labor. Common points include the webbing between your thumb and index finger, the area above your ankle, and the lower back. You can either try acupressure yourself or seek out a professional who can guide you. Number 6. Relaxation techniques. Stress and anxiety can sometimes delay the onset of labor, so finding ways to relax and calm your mind can be beneficial. Techniques such as deep breathing, meditation, prenatal yoga, and gentle stretching can help reduce tension and encourage your body to go into labor naturally. Number 7. Chiropractic care. Some women find that chiropractic adjustments, particularly those that focus on aligning the pelvis, can help induce labor. The idea is that proper alignment can help the baby move into the correct position for birth, which may encourage labor to start. Always seek care from a chiropractor who is experienced in treating pregnant women. Safety considerations. While these natural methods to induce labor are generally considered safe, it's essential to approach them with caution. Always consult with your healthcare provider before trying any method to ensure it's appropriate for your specific situation. Certain conditions, such as a history of preterm labor, placenta previa, or other pregnancy complications, may make some methods unsuitable or risky. Final thoughts. Inducing labor naturally can be a gentle way to encourage your body to start the birthing process, but it's important to remember that every pregnancy is different. What works for one person may not work for another, and ultimately, your baby will come when they are ready. By staying informed and consulting with your healthcare provider, you can make the best choices for you and your baby. As you approach your due date, try to stay patient and trust that your body knows what to do. Whether you opt to try some of these natural methods or simply wait for labor to begin on its own, the most important thing is that you feel supported and confident in your choices. Soon enough, you'll be holding your little one in your arms, and all the waiting will have been worth it.